So today I want to talk to you about something a little bit different than our usual topics. I want to address the digital elephant in the room and talk about AI, specifically AI in physio, AI regarding diagnoses. So because AI has been such a big thing, I thought I'd do a little bit of an experiment and try out a large language model. I won't go into the specifics of which one I've used just in case, but I thought I'd try one and see how good it was at diagnosing different conditions. And experimented, I started off with some basic things I expect the student physio to know. I tried some things where it was a bit more scary, a bit more dangerous, sinister pathologies, and some weird and wonderful things that I've only seen a couple of times in my career. And it was one of those things where it's quite interesting, and not in the sense of how accurate it is, but more in the sense of I realised after I've been experimenting with quite a few different conditions that I was thinking too much like a physio in this situation. I'm spoon feeding this computer, this software, almost the answer to my question. I'd explain all the symptoms that it could possibly have regarding one pathology and see if it can get it, and lo and behold, it gets it right. But I thought that's not realistic. No patients come in saying the exact details with every minutiae of what's gone on from a physio perspective. They're seeing it from a patient's perspective. So when I was being very specific and physio-led with regards to the ins and outs of it from a pathological point of view, it was quite accurate. And as you can imagine, when I started to be a bit more vague with my symptoms, like a patient often is, the answers I got back were quite vague. It's one of those things where the broader I was, the more it started to be a bit more cautious and say, well, it could be all of these hundreds of different things going on. So not the most useful of things. And often in those situations, even when I went slightly vague with it, the default was you should probably see a doctor or a physio or a GP or something about it as well. And it got me thinking about it because we're trying to make these AI things as human as possible, as useful as possible. But one thing that we were getting back from it was what we see with bad physios, bad clinicians, where if you tell a physio or a clinician that you've got certain symptoms, the bad physios usually want to say like, I know what's going on, it's exactly this, and that's what's happening with you. The good ones are the ones that think there's not enough information here, I need more information, I need to probe a bit deeper. Even in the situations where I was being quite vague with my symptoms, it didn't ask any further questions. It didn't say, can you elaborate on this? Can you elaborate on that? And what I mean by that is that sometimes we take people's information at face value. An example with knees is someone might come in and will say, do you have any, say my knee is locking. When we say locking, when it is a concerning thing, it's more that stick in a bike spoke situation. Your knee is stuck, it's not moving, you need your hand to move it. What patients often interpret locking as is being, my knee feels a bit stiff when I get up. So if you take it at face value of my knee is stuck, it could mean that you kind of start to panic and worry about things when you really don't need to. The skill comes in being like understanding that information, asking a few more questions and finding out the bread and butter of, is this something that we do need to worry about? Is this something that we don't need to worry about? And that's something that is almost completely absent in these large language models for it. It kind of reminds me a bit of from the Hitchhiker's Guide to the Galaxy, where they make this big supercomputer and they ask it, what's the meaning of life? And it says 42. And when they say that doesn't make any sense, they say you should ask better questions. And it's things along those lines. It's not just about, can this thing solve my problems? It's, you need to have that understanding of what's going on to get the good information from it. I hope that makes sense anyway. So overall, it was an interesting experiment I did with these things. I don't think it's something that is useful or even safe to diagnose yourself with, but at the same time, it was interesting. And I definitely think from my point of view of, if you ask the right questions from it, you can get some useful answers. The problem comes with knowing what questions to ask in the first place. As a physio going in for understanding more about certain pathologies, it can be quite useful. It's not going to replace me reading journal articles or staying up to date with research, but it is an interesting tool with it at the moment. Hopefully that sounds okay. Hopefully I'm making sense with it all. If you are suffering with any aches and pains or anything, as usual, you know where we are. Give us a call and we're happy to help out. Thanks. Take care.